This is a handheld ultrasound device which can be used in clinic to preoperatively assess a patient's anatomy and vascular pattern prior to injection of hyaluronic acid dermal filler. What I'm showing you today is the 7 transducer positions which have been described in a paper by Velthius. The aim of standardizing the assessment protocol is to produce a better quality image and allow for accurate interpretation. What you will see on the transducer is a marker which helps the operator to orientate the probe. Typically, we would direct this marker to the patient's right when in cranial orientation. When positioning the transducer, there are 3 standard planes. Sagittal, you can think from ear to ear, the coronal, nose to spine, and the axial, head to toe. Once we position, we can then use 3 probe movements to image the tissues. We can use angulation or tilting, a rotation motion, or shifting and gliding. Assessing the face, we start with the jawline position. The reference here is the masseter muscle. In this position, we will be looking for the facial vein and artery, and we can also visualize the parotid gland. Next, we move to the chin and lower lip, starting with the reference point of the depressor anguli oris muscle. The artery to be found in this position is the inferior labial artery. Now we will move to the upper lip. We place the transducer on the vermilion part of the upper lip. In this position, you will identify the orbicularis oris muscle and teeth. Here we are looking for the superior labial artery. In the midface, taking reference from the zygomaticus major muscle, you will slide from the zygoma towards the nose. In this position, the infraorbital artery will emerge from the infraorbital notch, whilst closer to the nose, the angular artery will appear. We can position the transducer to assess the nose by placing it sagittally and sliding up and down. Here we are looking for the lateral nasal arteries, the dorsal nasal arteries, and the intercanthal veins. To assess the temporal area, we place the transducer at the hairline and slide up and medially to the brow. Important arteries to review here are the transverse facial artery and the superficial temporal artery. The 7th position is looking at the forehead. You will place the transducer on the superior orbital rim and can slide medially and also cranially. In this area, you'll be looking for the supraorbital and supratrochlear arteries. By completing a preoperative facial assessment and vascular mapping, we can reduce the risk of complications when injecting dermal filler.